We understand the importance of a healthy diet when it comes to preventing diseases, but truly, how big of a role do vitamins play in disease prophylaxis, specifically pertaining to skin cancer? Joining us to share his professional perspective is Dr. J.B. Saleeby, Medical Director for Carolina Holistic Medicine. Dr. Saleeby, thank you for joining us today.
Oh, good to be here.
So to start this topic off, I want to ask you, is there such a thing as a healthy tan?
Wow, that's yeah. So some folks have a natural built-in sunblock. Folks with darker complexions, African Americans, they have more melanocyte activity, and that basically provides them with a natural sunblock. So in that case, yeah, that can be considered a good tan. If you do everything in moderation and are careful and take certain precautions, yeah, you can get a natural tan. And I think we're talking about photobiomodulation later, so that's something that you have to have exposure to good sunlight at the proper time during the day. So there are things to get around to get some color in your skin that is safe.
Now, as far as sunscreen goes, no matter your skin complexion, everyone should be using sunscreen, correct?
Yes, especially if you're out in the sun for protracted periods of time and you can't, let's say, cover up. So a big hat to cover, give you shade, long sleeves, long pants. If you're in a situation where it's super hot out and you want to, or at the beach and you want to get a little sun, yeah, you should apply some sunscreen or sunblock, SPF of 15 or better. But there's some caveats there. There's some ingredients in a lot of the commercially availables that are bad for you.
Okay. Is there a certain brand that you would recommend?
Well, not so much a certain brand, but I would recommend people going out and purchasing a sunblock to do their due diligence and read the ingredients. Things you want to avoid are things like oxybenzones, things like parabens and phthalates. Those are pretty toxic. Formaldehyde sometimes finds its way into some of these ingredients. So just go for more organic, natural sunblocks.
Okay, and also, is there anything, vitamins specifically, that we can take to help with natural blockage of the sun?
Sure, so there's some dietary things you can do to help reduce your risk for certain skin cancers. There's 3 main skin cancers, and those are green leafy vegetables, vitamins A and D and K, vitamin C, zinc and selenium, all are helpful.
3 different types of skin cancers, what are those?
Well, there's squamous cell, basal cell, and melanoma.
Okay, and how often should we be checking ourselves and going for a screening?
Yeah, so if you're low risk, that's no family history, no exposure to any chemicals like arsenic, which can raise your risk, and no family history or genetics that would predispose you, or in my case, not too many freckles. Somebody has a lot of freckles, they're a little bit higher risk. So maybe at least 12 months, get a dermatologist to do a body survey, a skin survey. If you're higher risk, then it's 6 months.
Okay.
Or at the discretion of your dermatologist, they might want to see you sooner.
So higher risk is family history. What else would consider someone high risk?
Genetics, exposure, previous history of, if you have a history of getting something cut off that was pre-malignant or malignant, then that raises your risk for recurrence.
Is there a certain demographic that is more affected by skin cancer?
Sure, fair-skinned folks.
Fair-skinned. Okay. And now you mentioned some food as well, some green leafy vegetables. Can you elaborate on those exactly?
Yeah, spinach, kale. Caveat there is that kale is one of the most sprayed crops, so make sure it's organic kale. Spinach and those bok choy, celery, anything green and leafy, anything with higher concentrations of lutein and lycopene.
Okay, and you also mentioned 1 year a checkup for low risk, about 6 months for high risk. At what age do you think that people should start going and getting checked?
Well, really at any age. If you're a little kid and you're in the sun all the time, there might be a call for doing screening earlier. If you're someone who stays indoors a lot, doesn't get a lot of sun exposure, maybe not as often, and maybe later in life. But if you notice anything, something scaly or dry, or something with unusual borders or changes in pigment, you got a mole, but it has 3 different colors in it, that's higher risk, so get that checked out.
Okay, awesome. Well, thank you so much, Dr. Saleeby.
Sure.
It's always a pleasure, and we look forward to having you back here next month.
Sure.
We're back in 2 minutes.